When studying for your nutrition test for fundamentals, it's important to keep in mind that a lot of the issues that the older adult has can be alleviated with nutrition. Some of the issues that are common to the older adult include decreased mobility, which can lead to decreased peristalsis, and also dehydration due to a decrease in the thirst mechanism. Keeping these in mind can help guide you towards what's important to study, because you as a nurse will need to know what to tell the patient to eat and avoid. These three issues can lead to constipation, and nutrition can help prevent constipation. Increase in water intake can help the patient have a bowel movement. Also, increase in fiber can help the patient have a bowel movement. It's important that you also know what foods can help the patient have a bowel movement, because although you're going to school to be a nurse, you are also an educator. That patient is looking for you to provide them with the information regarding what they need to do to fix the problem that they have. So don't be surprised if you see food items on your test. You need to know what foods are going to be high in fiber to help your patient. Nutrition is important for a lot of conditions. Additionally, you need to know what to inform the patient to avoid. There are foods out there that can actually cause constipation, so you need to know what to tell them. Skin breakdown is an issue for some older adults. And again, nutrition can help heal the patient's skin through supplements. Zinc is a very popular supplement that is often prescribed for patients with skin breakdown. Also, when a patient has skin breakdown or they're at risk for skin breakdown, it's important to increase their protein intake, because the protein will help to heal the wound. You do need to know what foods are high in protein so that the patient knows what to eat. Always encourage the patient who's at risk for skin breakdown or has a skin breakdown to eat their protein first. Some adults may have issues with reduced income. And when this is an issue, it's important to know what foods can be affordable for that patient so that you can inform them and help them to meet their nutrition goals. Also, some of the foods that are affordable may also be high in sodium. So you need to know which foods are high in sodium. These canned foods are less expensive than produce foods, and also they last longer, but they're higher in sodium. Additionally, there is the option of considering informing your patient about a food pantry that may be available within the community. Some medication issues can cause problems, and nutrition is a way to fix it. Common problems from meds may be a decreased appetite. You can suggest Ensure Glucerna or Boost, which has a good amount of carbs, proteins, and fats. Side effects from medication may cause uncomfortable issues such as diarrhea. You do need to know what foods to tell the patient to avoid that could cause the diarrhea to be worse, and what foods to eat that can help the diarrhea to not be as bad. Nausea is a common issue in hospital patients, and these are some foods that can help alleviate that issue. When studying for the older adult, again, keep in mind some issues that they have, because this can help guide you towards what to study for your test. You are going to have to know what foods to suggest to the patient, and also what foods the patient needs to avoid from making the issue worse.